Hi, my name is Molly Richards. I'm a provider at the BC4U Family Planning Clinic, and I'm going to talk to you about an IUD procedure. So first of all, when you get an IUD, you need to have a pelvic exam. If you haven't had one of those before, it means we use something which is called a speculum, which I'm going to show you, to look inside your vagina and look at your cervix, which is the bottom of your uterus. Sometimes we do this to test for infection. Sometimes we do this to do a pap smear, which is screening for cervical cancer, but we do it for an IUD insertion. So this is a speculum, right? We have plastic speculums here, and what we do, if we look at this model, this would be your vagina, right? This is your uterus, and the bottom is your cervix, right? So we put the speculum inside the vagina. This tends to be pretty uncomfortable. It just causes a lot of pressure, but people tend to tolerate it very well. We put it inside the vagina and we open it up slightly. So sometimes you'll hear a little clicking when it opens. That allows us to see the bottom of your uterus, which is your cervix. There's already a hole in the cervix up into the uterus. We do not need to make one to put an IUD in. When we put the IUD in, there's a couple things we do. We take Q-tips and we actually clean the bottom of the cervix with iodine. Then the procedure itself, I usually say, is 3 big cramps. The whole procedure is usually less than 5 minutes. Most people describe it as really severe menstrual cramping. You can get nauseous and dizzy. Those are all very normal responses that are usually temporary. So what we do is we put something on the uterus just to hold it in place. Then we put something inside the uterus to measure the length of it, and then we put the IUD in, right? Once that's over, we'll take the speculum out, okay, which tends to feel a lot better. There is a string that comes out of the cervix just a couple centimeters. It does not come out of the vagina. You should not feel it or notice it. You also don't have to check the string if you don't want to. We can check it at any time if you feel like there's problems. There's a couple things to watch for after your IUD insertion. One is infection, which is very uncommon, but if you ever had a fever or discharge or other concerns, we'd want you to call us. Another risk of the IUD insertion, which is also very uncommon, is the IUD being placed outside of the uterus. We do not expect this to happen, but if it does, it would have to be surgically removed. Another thing is an IUD actually expulsing or coming out into the cervix. This is not dangerous. Usually, if it's a hormonal IUD, it'll still function, like it'll work to prevent pregnancy. But if it causes symptoms like worse cramping, pain with sex, if your partner ever feels plastic during sex, those would be reasons to come in so we could check it out and maybe replace it. The other thing is pregnancy. Although it's very uncommon to get pregnant with the IUD, it can happen. So if you have symptoms of pregnancy, you want to take a pregnancy test or let us know, because pregnancies with an IUD can be more complicated. Despite all that, IUDs are a very safe birth control. The procedure is very safe and very quick, so we think you'll be happy with your choice. If you have any other questions or concerns, you can always call us, or you can ask your provider at your visit.